San Francisco, a city grappling with a familiar foe, the opioid epidemic, yet a new danger lurks in the shadows, adding another layer to this public health crisis. A recent inquiry revealed a disturbing trend: the presence of xylazine, a powerful veterinary tranquilizer, in street drugs. Xylazine, often called tranq or zombie drug on the streets, is not meant for human consumption. It's an animal sedative, typically used by veterinarians to sedate large animals like horses. When mixed with opioids like fentanyl, it creates a deadly cocktail, amplifying the risks of overdose and death. Reports from across the United States suggest a growing presence of xylazine in the drug supply, indicating a wider problem that demands immediate attention. This new threat underscores the ever-evolving nature of the drug crisis. The discovery of xylazine in street drugs is a stark reminder of the vulnerability of our communities to emerging drug threats and the urgent need for comprehensive strategies to address them. Xylazine is a non-opioid drug belonging to a class of drugs known as alpha-2 adrenergic agonists. In veterinary medicine, it's a vital tool used for sedation, anesthesia, and pain management in animals. The drug works by acting on the central nervous system, suppressing the release of norepinephrine, a neurotransmitter involved in arousal and alertness. While effective in animals, these effects can be extremely dangerous in humans, especially when xylazine is combined with other substances like opioids. It's believed that the drug is being added to opioids like fentanyl to enhance its effects, potentially making the high more potent or longer lasting. However, this combination is incredibly risky. Xylazine can exacerbate the respiratory depression caused by opioids, significantly increasing the likelihood of an overdose. Moreover, xylazine can cause severe tissue damage, leading to necrotic wounds that are slow to heal and prone to infection. The emergence of xylazine in the drug supply is a major public health crisis unfolding before our eyes. Its presence, often hidden, adds a dangerous layer of complexity to the ongoing opioid epidemic. Naloxone, the life-saving medication used to reverse opioid overdoses, is ineffective against xylazine. This is because xylazine is not an opioid, therefore naloxone cannot reverse its effects. Identifying a xylazine-involved overdose can be difficult, as the symptoms can mimic those of an opioid overdose. This makes it crucial to have access to rapid testing kits that can detect the presence of xylazine in the drug supply or in individuals suspected of overdose. The spread of xylazine is not limited to major cities like San Francisco. Reports suggest that it's becoming increasingly prevalent in the illicit drug supply across the United States and even internationally. The rise of xylazine presents a formidable challenge for law enforcement agencies across the country. Tackling this emerging threat requires a shift in strategy, moving beyond traditional drug enforcement tactics towards a more nuanced approach that prioritizes public health and harm reduction. One of the main challenges law enforcement faces is the difficulty in detecting xylazine. Unlike fentanyl, which can be detected in trace amounts, xylazine requires a larger sample size for identification. Furthermore, the legal status of xylazine adds another layer of complexity. While xylazine is a controlled substance for animals, it is not currently classified as a controlled substance for humans at the federal level. This legal loophole makes it more difficult to regulate and control the distribution of xylazine, hindering efforts to curb its diversion for illicit use. The emergence of xylazine in the drug supply is not merely a public health crisis, it is a societal crisis. Its impact extends beyond those who use drugs, affecting families, communities, and healthcare systems already grappling with the opioid epidemic. The social and economic costs associated with xylazine use, including healthcare expenses, lost productivity, and increased crime, are substantial. The xylazine crisis shares similarities with other drug epidemics, such as the crack cocaine epidemic of the 1980s and the ongoing opioid crisis. These epidemics highlight the complex interplay of social, economic, and political factors that contribute to drug use and addiction. One crucial lesson learned from past epidemics is the importance of avoiding punitive measures that criminalize drug use. Instead, a more effective strategy focuses on expanding access to treatment, harm reduction services, and social support. The xylazine crisis demands urgent action. We need a multi-pronged approach that prioritizes prevention, harm reduction, and access to treatment. This requires a collaborative effort involving policymakers, healthcare providers, law enforcement, and community organizations. Prevention efforts must focus on reducing the demand for illicit drugs. This includes addressing the root causes of drug use, such as poverty, trauma, and lack of opportunity. Investing in education, mental health services, and social programs can help create healthier communities and reduce the allure of drugs. Harm reduction strategies aim to minimize the negative consequences associated with drug use. This includes providing access to clean needles and syringes, naloxone for opioid overdose reversal, and drug checking services to identify the presence of xylazine and other dangerous substances. Safe consumption sites, while controversial, can also play a role in reducing overdoses and connecting people to treatment. We must move away from punitive measures that criminalize drug use and embrace a public health approach that prioritizes compassion, evidence-based interventions, and the well-being of all members of our community.